So who is dominating in this Western medicine too? It was always a medical, let me say, to the Indian perspective it's a medical doctor, others it may differ. It may a little bit differ, but predominantly the prescription power of autonomy to write the medicine is the person who is holding the center point of this medicine. So here, in this politics of doctor, nurse, other health workers, we say WHO. WHO says that for these many, for example, let's say 5 patients, 1 nurse should be there in general ward. Those are the standards. Started in Australia in 2000. History I won't go. So currently that's standard. Is it same for all the countries? Can we, as sitting here, accept those standards? For example, in India, I worked 35 years in India, partly in hospital, partly in research too. So if you have 40 beds here, there is 1 nurse, every patient has 2 attendants, family people to take care of. In this kind of situation, do we need 1:5 nurses? And in adding to that, we have also a nursing assistant, a nursing other. So that's the first question. And second question is now say globally the doctors and nurses, there is shortage, the heavy shortage of nurses. Now question comes, where is the shortage? Basically global north, majority of the shortages, which is supposed to be, as a WHO says, the highest shortage in Southeast Asia and African countries. That is what WHO says. Now the question mark comes, is it really so? If it is so, then Southeast Asia, for example, Philippines should put a, say, we need more nurses. Can UK and other nurses can come? No, it's not happening. Saying UK and European countries need nurses, Asian countries need nurses. But we are saying nurses, and we are taking nurses from Philippines, the country which has a shortage. So is there some mismatch? So today I am presenting the nursing scenario from the eyes of Indian and eyes of a nurse. I am also a nurse student, so I won't take you much time. There is one paper which is circulated now. I just put a bird view of Indian healthcare system. It's a pyramid system which is sub-center for every 5,000 population, primary health center for 20,000 population, community health center and district hospital. This is basic model. The first in the auxiliary nurse midwife, A&M states for, recently they added mid-level health worker there. So here the nurse comes in, registered nurse said to be, then primary health center. These are the places where nurses work. Now, parallelly we have many other local doctors, healers everywhere. And we have regional hospitals, taluk hospitals, and different kinds of hospitals where nurses are working in.
Taluk is Kreis. In German.
So, why I brought this is, parallelly we have private hospital which is now said to be more than 82% of the Indians go outpatient care in private. Let me specify only private. Okay? And in inpatient, when you want to get admitted, there is more in the public hospital. So that is what. Now comes to nurses. In Indian nursing, we have 2 kinds of nurses. Diploma in nursing and bachelors in nursing. Okay? Let's not go into that. But where are these? Till 2000, India had only around 400 plus nursing colleges. I joined in nursing in 2002. In my state, my Lena, we are having only 81 nursing colleges. In 2005, it became 456 or something. And currently we have, I told around in India in 2000 were 400, now we have 4,000 plus nursing colleges. Number one, who has started it? Private schools. Completely, over 97% of nursing colleges are private. Okay, that's important to note. And we spent around 5 to 6 lakhs to study the nursing, each student. And remember, these private institutions are subsidized by government. There is a government cost involved in it. Next comes the point is, who is doing nursing? Nursing is done by not by upper class people who has money. It's done by middle. In Germany also, I have tried to see who are the nurses who wanted to become a nurse are also not so. That's what my presentation in 4 years. We can discuss on it. So now, a lower or middle class female, basically female, spent 3 to 4, let's say 6 thousand euro, which is a huge amount. To tell you, the nurse's salary in private hospital is only 100 to 200 euro. And 80% of the nurses are working in these hospitals. I am a nurse from middle economic family, took credit from bank, studied, and trying to support my family, work for the society. I spent 5,000 euro, 6,000 or 5,000 euro, monthly getting how much? After 3 or 4 years, 200 to 300 euro. So you need to repay around 5 to 6 years. Question number one. Question number two, what is happening to the state? We say there are less amount of nurses. Why they are not recruiting? Because of state is not ready to recruit the nurses on good contract. That's a state, etc. They are not doing it. They reduced it. Additionally, what they did is contractualization. That's highest. A state, etc. in hospital, a nurse gets 800 to 1,000 euro per month. Okay. In the same hospital, government hospital, a contractual nurse comes in. That means she has to work only 11 months there. 1 month is a gap orally, but they will be working there. They get only 500 or 300 euro. But they don't have rights. They don't. So third one, another one layer comes in recently is outsourcing. For example, let's say Christiana had a good contacts and she has one agency, she supplies nurses to me. I am a hospital administrator. It's a public hospital, government hospital. Now, whom Christiana is sending, I don't know, but I believe Christiana's organization and say that I will pay directly to Christiana whatever she does to me. And the payment goes again to 200 to 300 euros. In this scenario, when annually we are producing 50,000 nurses surplus, that's enough. So, where is the shortage? Shortage is existing within the country's part where they are not able to recruit them, not able to give the jobs, or the shortage is so the eyes of WHO and the people who are looking at, oh, Philippines has a shortage, no, stop the migration. Should we look at that way? Or what should we do? This is what a question we have. I try to look at. So, in my group activity, we will do 2 kinds of views. One is systemic view. That is, a country which is exporting the nurses to other countries, what is the impact? Definitely we should look at it. A time comes when there will be shortage. For example, we take India, Philippines, systemic view. Another one is a nurse point view, or anybody who is there, their view, how to do it, how to look at it. With that, we will discuss in our group discussion. Thank you.